Hello friends. Today we are going to discuss about empathy, a very important life skill. I am Dr. Suresh Badadmat, Professor of Psychiatry working at NIMANS Bangalore. Before I start my presentation, I would like to place this disclaimer. This presentation is for academic and training purpose only, not for clinical or legal opinion. For clinical opinion, please do contact a psychiatrist. For legal opinion, please do contact an advocate. Conflict of interest? None. In this video, I am going to discuss about empathy. That is the definition of empathy. What is the meaning of empathy? What are the skills required to learn empathy? And how to teach empathy for children and adolescents. This video is targeted to school and college administration, teachers, policymakers, parents, children, NGO, corporates, and community at large. Before we discuss about empathy, let's understand about the core set of life skills. There are three important categories of life skills which have been defined. These are defined by World Health Organization. The first one is thinking, also called as cognitive domain, which has creative thinking, critical thinking, problem solving, and decision making. The second one is emotional domain, coping with emotions, empathy, coping with stress, and self awareness. And the final one is social domain. Here, effective communication and interpersonal skills. Here we are going to discuss about empathy. Let's understand empathy and define it. Empathy means it is the ability to sense other people's emotion coupled with ability to imagine what someone else might be thinking or feeling. Let's make it very simpler. Empathy is ability to understand what other people feel, see things from different perspective, and imagine yourself in their place. So, the empathy has three important attributes. One is ability to understand other people's emotion, ability to understand their thought process, and you need to imagine yourself in their place. That means you're understanding not only by thought process, emotions, and you are putting yourself in their place. To make it very simple, emotionally, it is putting yourself in someone else's position and feeling what they must be feeling. That's what is empathy all about. But however, you need to know, no book or video can teach you about empathy or else compassion, warmth. You need to learn by seeing, doing, and talking to patients and other people. There are two important verbal skill and non-verbal skill. I'll be discussing about those in a short while. But however, one need to differentiate between empathy and sympathy. Sympathy means feeling sorry for someone else. That means it is more at the cognitive level. That means you say, oh, he has been hurt. That's it. But however, empathy means feeling with the someone else. That means if a person is hurt, you will also feel the same pain. The pain is not only emotional, sometimes even physical pain also may be there. That means sympathy is at superficial level. Empathy is at the depth level. That means sympathy here you are going to just say at the words, at the cognitive level. Empathy is at the deeper emotional level. Now, what is the need to understand about empathy? That is, what is the purpose of empathy? First and the foremost, to understand others' person perspective, building rapport with other people, getting to know people around you. That is, you are going to understand not only cognitively but also emotionally. Empathy has therapeutic in nature. That means it has healing power. Empathy is the foundation of emotional intelligence. That means you are going to learn about emotional quotient or emotional intelligence. First, you need to understand empathy. Not only that, at workplace, understanding your colleagues or clients. And to be successful at workplace, empathy plays a major role. In personal life, if you have good empathy, you have excellent interpersonal skills with family, friends, relatives. Not only that, you will have a meaningful quality of life. Not only that, People will like you, love you, and also praise you. And empathy helps to heal other people. Suppose if your friend is in pain and you have a very good empathizing skill, you can heal that person. Empathetic people have a good relationship with family, friends, colleagues, society, and they are usually considered as very caring people. One of the other important role of empathy is to understand where is the locus of control. Your thoughts, your emotions, behavior, and sensation are usually internal in nature. That means you have control over your emotions, thoughts, behaviors, and sensation. Unfortunately, if the person says, my thoughts are dependent on other people, my emotions are dependent on the environment, my behavior is dependent on others, that means you are at the mercy of the environment. You do not have any control over either the thoughts, emotions, and behavior. Empathy will teach you that your thoughts, emotions, behavior is under your control. That means empathy plays a major role in shifting the locus of control from external to internal. One best example is happiness is not in the environment. Happiness is inside within you. You need to find happiness in yourself. No need to find happiness outside the world or in the external environment. That is what is locus of control. That means finding peace, inner peace is considered as very essential in empathy. What are the attributes of empathy? Teresa Weisman discussed important four components or attributes of empathy. First and the foremost is able to see the world as others see it. As we know, we interpret the world as we see. In empathy, you will start seeing from other perspective also. You need to be non-judgmental. That is the second important attribute. Third one is understanding the other people's feeling. Why do they feel like that? What did they perceive the world? How did they perceive the world? Not only that. Once you have understood the people's feeling, you need to communicate that I've understood that you're feeling or you're going through this feeling. That means the person will be very happy. This person is not only able to understand my situation, but is able to feel what I'm going through. These are the important attributes of empathy. Let's understand whether this empathy is biological in nature or is it environmental? Is it a nature or nurture? Empathy, is it by birth or it is learned skill over a period of time? If you look at the research, it clearly says that ability to empathize is traced to genetic predisposition. That means it is by birth. If you look at the emotional empathy, that means after the child is born, within 3 months to 6 months, the child starts connecting with the mother. It is able to identify the mother, able to give smile to the mother. Whenever it is distressed, it is able to cry and able to induce same kind of feeling in mother and other family members. That means emotional empathy invariably starts in the infant stage. Not only that, if you look at psychopaths or antisocial personality disorder people, all along their life, any amount of training, they may not be able to feel what the other person feels. That means there is a complete lack of empathy in those people. That means there is a high loading of genetic predisposition. But however, we need to understand it is also true that empathy is still can be increased or decreased by training purpose. Here you are going to improve the cognitive empathy. The emotional empathy is very difficult unless you are able to feel for it. Empathy is commonly seen with people whom we are very close, or we identify, or we recognize that we belong to the community. For example, if there is a death in the family, you will feel severe pain. Whereas if there is a death somewhere else in the country, you don't feel the pain. If your family member is suffering, you will feel severe pain, that is emotional pain. But however, if some third party is suffering, you don't feel the pain. Not only that, if you identify with a community and a person in the community in your community gets hurt, you will also feel the same. That means ability to recognize, that he belongs to you, ability to have a bonding with him plays a major role in empathy. Empathy develops by the virtue of bonding. Again, this bonding occurs by communication, which can be learnt. Hence, it is also considered as empathy is a trainable skill, especially with regard to cognitive empathy, what I said. So, empathy becomes very essential in a group of people who are able to be bonded or who are able to connect with each other. Now, we have understood yes, empathy has both nature and nurture, both play an important role. Let's understand what is the neurobiology of empathy. How empathizing skills are how a person's brain gets activated when there is empathy. For that, there is something called as mirror neuron system. Initially, it was identified in monkeys. Here, the mirror neuron system means it is a group of specialized neuron, especially in the premotor and parietal cortex, that mirrors the action and behaviors of others. If a monkey sees the other monkey picking up banana or resins, the monkey which is watching and do not have access to resin or the banana, even the monkey's brain, the one which is observing, also has activity in the premotor and parietal cortex. That means while seeing and feeling, it is able to feel the other monkey what it is doing. So, to understand, we need to have examples. The example I can give you is imagine a child who is 1 year old, who is connected or bonded with the mother. The child is playing and suddenly falls down. And once the mother sees it, even the mother also feels the same pain. That means here the mirror neurons are activated in the mother. Similarly, if the child is playing with the scissor and the child gets cut in his finger, the mother also immediately feels the same pain, both emotionally and physical pain. That is considered as mirror neuron. One more best example is yawning. Imagine if a group of friends are sitting and discussing, one of them yawns. In the group, other person also starts yawning. That means his mirror neuron systems gets activated. So that is considered as mirror neuron system. Mirror neuron systems seems to bridge the gap between one agent to another to represent my action and your action in the same way. And Ramachandran has clearly said that mirror neurons are the driving force behind the great leap forward in human evolution. That means the animal or the human being is different from animal by the virtue of mirror neuron system. That means the human need not go through the experience. By watching another person going through that, the human also will be able to feel the same pain. That means it has an evolutionary perspective with regard to mirror neuron system. If you look at the areas in human beings which have been identified by various MRI studies, PET study, SPECT study, and electrophysiological studies, it clearly indicated parietal cortex, anterior insula, anterior cingulate cortex, amygdala, and premotor cortex. These have been found to be important as a mirror neuron system with regard to humans. So, mirror neurons are the key to understand social cognition, ability to understand the action of others and read their minds, to imitate, to communicate using gesture and speech. So, empathy also relies on important things. So, empathy has a neurobiological basis through mirror neuron system. Now, let's understand what are the different types of empathy. As I mentioned earlier, cognitive empathy, emotional empathy, and compassionate empathy. Cognitive empathy is simply knowing how the other person feels and thinks. That means it is more of at the cognitive level. You may not be feeling what is happening with him. Whereas emotional empathy is knowing how the other person feels, thinks, and feel the same. That means you're not only understanding at the thought process, you are able to feel the same pain how the other person is feeling. That is emotional empathy. Moving to compassionate empathy, knowing how the other person feels, thinks, and feel the same and spontaneously move to help him. That means in compassionate empathy, you are moving forward to help him because you have found that that person is in pain and at the same time you are able to understand the situation. You want to help him and ease his pain. So now the question is how to teach empathy. First and the foremost, let's discuss about teaching empathy in children and adolescents. Before we teach them, they need to understand what is emotion, identify those emotions, how to identify that. The best way is emoticons, pictures. You need to show to these children and ask them to identify various types of emotional face so that they're able to recognize that yes, this is happy face, this is sad face, this is frustration face, this is anger face. Once they are able to identify in the picture, now whenever the child goes through similar kind of experience, imagine the child is crying. Now the parents need to say, oh, you are feeling sad, that is the reason you are crying. That means whenever the child has similar kind of experience, the parents need to help them to identify it and feel those emotions. At the same time, parents also need to express their emotions and label it. Imagine the child is pestering. The mother or the father should say, you are making me angry. Look at my face, I'm angry. So that means the child is able to understand the mother is angry and how the face looks. At the same time, you need to encourage the children to express their emotion and also label them. So the child also says, yes, I'm feeling sad because you did not help me. You did not give me the toy. So this expression of emotion is very essential. Once they are able to move till there, now you need to teach the child to identify emotions in others. How to do that? Especially the children from the age of 6 to 12, you need to teach these identifying emotions in animation characters. Maybe Tom and Jerry, Chota Beam, and various other animations. Stop, pause the video, and ask them what is that character is feeling now. It may be movies. You need to show those movies and particular time when the character in that movie is showing anger. You need to pause and ask the child, what is that person is feeling? Why does he feeling? Why does he is angry? Those kind of things question needs to be questioned. So use animations, movies, and videos, maybe pictures, to identify and discuss about those feeling. Not only that, role playing and helping the child to feel other person's feeling needs to be done. Here, you may ask the child, when the child has fallen down in a ground, you need to ask the child, what is happening with the child? And your child should be able to say he has fallen down, he has hurt, he's having a pain in his leg, and he is crying. And you need to inquire emotions. The child, whenever goes through a difficult situation or else in a happy phase, you need to inquire, how are you feeling? And every day in the morning, you need to ask, how are you feeling? So that the child knows expressing emotion, having different emotion is normal. Just because one person is feeling sad doesn't mean that he is depressed. Having the range of emotions, that is happiness, sadness, anger, frustration, shy, all these are a part of emotional experience. One need to understand these emotions are not permanent. Today you are happy, tomorrow you may be sad, day after tomorrow you may be angry. So that means it is a part of living. At the same time, understanding others' emotions also is essential and helping others. So here the important component is teachers and parents need to do role modeling. That means with regard to emotions expression, controlling their emotions, showing their emotions, at the same time regulating their emotions, naming them, labeling them, and telling their children. And one other important point the parents and teacher need to discuss is point of view discussion in groups. For example, you need to make a group of 7 or 10 people, children, and then one of the child is bullied. Now, let's discuss how the child feels when he is bullied. It may be showing an animation, picture, or story. Now, all the children need to name what are the emotions the child who is going through bullying faces so that the children are able to identify, label, and emotionally connect with the child who is going through bullying. Sometimes you need to take the children to the old age, orphanage, ashrams so that they know the world. At the same time, what is happening with other people also they should understand. You're not just taking them to the old age. You need to take them and make them interact with the elderly population, orphanage, so that the child is able to understand what they are going through. Not only that, you need to teach our children how to help others. If there is an accident victim, disaster survivor, you need to help teach your child how to help them so that the child knows it is his responsibility to help the fellow colleagues and also feel pain for other people. And also, you need to teach listening skills or else even interviewing a person with disability or underprivileged so that the child knows what are the difficulties the various other people go through. Another important activity which all children and adolescents need to know is journaling the activities and emotions as the forefront. That means you need to give activities to the children, especially in the age of 10 to 12 years. You have to say, today you are going to help one of your friend or neighbor, document that. Not only that, you will document how did you feel when you helped somebody else. The second, one more activity you can give after few days is assisting your parents in household activities. That means you can tell a child, today you are going to help your mother for 30 minutes. After that, you're going to write down what you have done to help your mother and how did you feel after helping your mother. Not only that, did you identify what was your mother's response and how did she feel when she saw you helping her. Not only that, you can give some other activities like feeding a stray animal, maybe a dog. By sharing your lunch with a dog, how did you feel? How did the dog behave? Not only that, having a lunch with a different person, may not be a friend, may a third person, discussing with him what is happening in his life, understanding his perspective. That means the child is now making efforts to learn what is happening in other person's life. And act of kindness with stranger, like giving money to a beggar or a stranger or a person who is in need. Not only that, charity work. And also, if a child is crying, ask your child to see what is happening and why the child is feeling like that and how he feels when the child is crying. So, these are the situation where the parents play a major role with regard to role modeling about managing, regulating their emotions, and expressing their emotions. Now, let's move one step ahead. How to teach empathy skills. There are two important things, verbal skills and non-verbal skills. So let's move into verbal skills. First and the foremost, one need to understand about empathy statements. Here, the child and the adolescent should know when a person has lost his job or lost his pencil, maybe he has lost his book, and the person is feeling sad or anger, the child need to help him. And also, if the child is able to express, you must have felt terrible when you lost the job or when you lost the book. So, coupled with appropriate verbal skills and non-verbal skills, if these kind of empathy statements are made, that person is going to become very close to the child who is showing empathy statement. Not only that, the child also need to learn about paraphrasing. If the person says, this book is very important to me, this book was given by my mother. If I lost that book, that means I'll feel very sad. Now, the other child need to paraphrase it. You said that if you lost that book, that means you felt sad. Can you tell me more about that? Why are you feeling so sad? Why this book is very important to you? Such kind of questions will bring those two child emotionally connected. If that other person is not expressing emotion, directly asking about emotion. The child can ask, How do you feel when you lost your job or book? Can you tell me more about that? Sometimes the other child can also ask reflecting statement. You look distressed. You look sad. What happened? When you said that when you lost the book, you felt sad. Can you express more about that? Can you tell me more about that? That means inquiring about the emotions. Not only that, recognizing the emotions, paraphrasing, and also empathizing plays a very essential role. Further, waiting for an opportunity. Whenever a person shows highly emotional loaded words, adjectives, difficult situation, inquire about the emotion. If the person becomes very angry, at that time, you need to keep quiet. And after some time, you need to ask, what happened? Why was there so much of emotion? Why did you think about that? What happened? Can you express? Can you tell me more about that? After some time, you can validate their emotion, saying that, yes, of course, in your case, any person will feel the same. Even I may feel the same. I also felt the same. But however, feeling the same and behavior are two entirely different because emotions, range of emotions, feeling those emotions are normal, but your behavior is under your control and you need to learn how to control your emotions also. That is regulating your emotions. The children need to be taught about open-ended question. Here, like how can I help you? Tell me more about. Please explain. How does this problem make you feel? What makes this problem so difficult to deal? What positive changes would you like to see to happen in your life? In general, how would you describe your mood, feeling, your job, your marriage, your girlfriend? So, these kinds of open ended questions will help the other person to talk about his life openly. There is no anything yes or no answer. So, such kinds of open ended questions need to be taught so that the children and adolescent can learn these open ended questions and help their friends and relatives. However, if the other person is not responding or talking much, closed ended questions also be used, but very sparingly it has to be used. Like, did you feel get good sleep in the night? Did you get irritable? How are you? Had breakfast? How did you? Why did you fight with your parents? Do you know about depression? Do you feel anxious? Do you hear voices? Do you feel cheerful? So these kinds of answers will have yes or no. This can be used only when the person does not speak. With the verbal skills, now we need to understand about non-verbal skills. Non-verbal skills, when two children are discussing, sometimes allowing silence during the emotional response is very essential. That means the other person is silent, allowing the person who is distressed to express his emotion. One need to be comfortable with silence, maybe with crying. If other person is crying, you need to be silent and allow the person to ventilate. Do not say, stop crying. Do not say, don't express your emotion. Please allow them to ventilate. One need to understand about improve the listening skills. If a person is able to actively listen, make appropriate facial expression, decoding the body language of the other person, inquiring and allowing the person to express his emotion, giving time to another person, having appropriate body language, open body postures, these kinds of non-verbal skills play a very essential role in developing empathy. Further, dress code, greeting the person, offering chair, making eye contact, appropriate facial expression, head nodding, leaning forward, having open hand gestures, all those things plays an important role in empathy. Further, having a calm, cool body posture, the way you sit when the other person is in distress, using your space so that the other person also able to express himself, giving time to express emotion, the tone tempo of your speech, your reaction to the person's experience also plays a role. If the person says, I felt so sad. I felt like killing myself. Immediately, don't say, "What? You wanted to kill yourself? Are you gone crazy?" Don't use such words. The way you respond also plays an important role, and you need to give undivided attention. And non judgmental posture helps in empathy. So, you have understood about the skills which are needed to learn empathy and how to teach them. Now, the questions are, what are the challenges to learn empathy? First and the foremost is cognitive bias. What do you mean by cognitive bias? Imagine if there are children who are taking risk, jumping from the compound, you have told them not to do that. But unfortunately, one of the child fell down and sustained injury. Many people feel that he deserved it. You don't feel empathy here. The reason being is they did not listen to you. They did not accept your suggestion or advice. That kind of cognitive bias are commonly seen. Or else imagine you do not like certain community in the society. One of the person in the community has sustained injury. You do not feel pain to them. Again, there is cognitive bias. Sometimes fear, anxiety may also come in the way of empathy. Past trauma. Imagine if one of your family member, maybe your uncle, used to treat you very badly, and tomorrow you come to know that person had cancer or has cancer. You may not feel empathizing towards that person. You may feel that person deserved it because he had hurt me in the past. Many a time, poor listening skills, poor attention also come in the way empathy. Lack of time. You are a busy person. When your child says there are people or their children who are bullying him, but you don't have time to sit with the child and discuss. Again, since you do not spend time, you may not be able to understand the feelings and pain your child is going through. Sometimes you may not have any solution to the problem. There also, you want to avoid that person. Imagine one of your friend comes and says he does not have money. He is going through a very difficult situation. You are afraid he may ask money or he may ask loan from you. In such a scenario also you may not feel empathy. Language problem, cultural barrier, and also compassion fatigue. Let's understand about compassion fatigue. Compassion fatigue means an identifiable set of negative psychological symptoms that caregiver experience as a result of providing care while being exposed to either primary trauma or secondary trauma. Primary trauma means experiencing the trauma firsthand. Secondary trauma is rendering care to the person who is going through the trauma. Let me give an example. Imagine if there is a road traffic accident. If the doctor is there inside the bus and he has watched the person in front of him having sustained a severe injury and he has been providing care for the accident victim since many years, he may not feel the pain at all, though he is also a primary survivor. That means he has a compassion fatigue. He is unable to feel the pain of the survivor. Imagine he has not witnessed the accident, but he is working in a casualty and a group of survivors are brought for treatment. There also, he doesn't feel the pain of the survivors. Again, there also we can consider it as compassion fatigue. Compassion fatigue usually involves maybe irritable, distressed, numbness, not able to feel, poor attention and concentration, becoming having irritable spells or crying very easily, unable to concentrate, unable to make any judgment, poor memory. So these kinds of compassion fatigue are common in doctors, especially working in emergency, casualty, working in oncology or cancer institute, or else in children where the mortality is very high. If the doctor is working in such a situation, compassion fatigue is very high. So, compassion fatigue, I'll be making a different video with regard to this. To conclude, my dear friends, empathy is the foundation of emotional quotient and emotional intelligence. Teaching empathy is challenge, but worth doing it. Empathetic person will have a good interpersonal relationship with friends, relatives, and other family members. The quality of life of empathetic person will be very good. And you need to understand, if the empathy is done everywhere, there is a possibility of compassion fatigue that needs to be kept in mind. Further, communication is not always with words. You need to understand non-verbal skills also. The way we sit, the way we make eye contact, the way we nod with the client or the other person also makes a difference. You need to be comfortable with silence. You need to be comfortable if the other person is expressing emotion. It may be sadness, it may be frustration, maybe anger, because emotions are common. The range of emotions are normal. Every person will go through these emotions, and it is normal to feel all those emotions. The issue is the behavior secondary to those emotions need to be controlled. And very important in empathy is simply being there and sharing with a meaningful eye contact, understanding their emotions plays a major role in anybody's life. Thank you very much for giving your valuable time. Stay safe.